Hello, I'm Betty Casey, editor of Tulsa Kids Magazine. We've partnered with the Children's Hospital at St. Francis to bring you information to keep your family healthy. Today, we're talking to Dr. Naina Gross, a pediatric neurosurgeon with Warren Clinic. She's been in practice about 17 years. She's board certified in neurosurgery and pediatric neurosurgery. She worked at OU for 15 years and moved to St. Francis about 2.5 years ago. Welcome, Dr. Gross.
Thank you.
Thank you for being here. Okay, so we're going to talk about plagiocephaly, or as we lay people know it, flat head syndrome in infants. So let's just start off with defining flat head syndrome, and then you might tell us how common that is.
So, flat head syndrome or plagiocephaly is just basically molding of the skull due to pressure. So it became a very well known and very common problem with the whole back to sleep campaign for SIDS. So infants will lay on the back of their head to sleep. And so then often, since infants sleep a lot, we'll get essentially molding of the skull from the external force of the bed, essentially. And so it is a very common problem since the back to sleep campaign came about.
Right, thank you. That was one of my questions. So when do parents or maybe the child's pediatrician start noticing this? And are there signs that parents should look for? I mean, obviously flat head, but how concerned should parents be?
So, generally we will see it mentioned in pediatrician notes even as early as 2 months of age.
Hmm.
Occasionally we will have a child that's born with what we call congenital plagiocephaly. So it was molding that occurred in utero. So while in mom, from being up against a rib or up against the pelvic bone or something where the head didn't have room to, or wasn't moving around, and so got molded initially. But as you know, most babies come out with pretty abnormal shaped heads to begin with. So generally we say give it a few weeks to see, if the birth molding essentially will change. But as far as like acquired positional molding, it takes a couple of months. It's not something that happens overnight. And when you're looking at your child every day, it might not be something that you necessarily notice because this changes would be slow. We generally will get referrals anywhere from 2 months to 10 months of age, just depending on the pediatricians or the primary care doctor's level of comfort, concern with the situation, and sometimes the family's level of comfort or concern. Plagiocephaly is not dangerous, so it is not going to cause any detriment to the child as far as their brain growth and development. Because, sorry, that computer just beeped. It doesn't cause any problems with brain growth or development, doesn't put any undue pressure on the brain. So it's not a dangerous situation. It's a cosmetic situation. So it's just a look of the head problem.
Okay. So if the back to sleep, this is going back to the back to sleep, putting infants on their backs, that is recommended for safe sleep. Is there a way to alleviate that problem? Like, are there things that parents can do? Because we do want to have safe sleep, but are there things that parents can do to keep their child's head from flattening?
So, yeah, during awake times, obviously positioning them so they're not on the back of their head. So what we call tummy time. So having them on their stomach. Every newborn or infant hates tummy time initially. So, but they generally will get used to it. And a lot of that is just when they can start kind of holding their head up and kind of pushing themselves up. But anytime off the back of the head while the child is awake and not sleeping will alleviate some of that kind of pressure time that the skull is feeling. If we often see too plagiocephaly, it's just like one side, so the infant maybe prefers to lay on one side of their head. So if it is like just the right side that's flattening and the left side isn't, then we recommend just repositioning techniques to put the pressure over to the left side of the head. Like in the car seat, having toys, you know, on the left side of the head to draw the baby's attention to that side versus the side that's flat. So pretty much just anything that the parents can do to spend time off that flat area of the head when the child is awake and not sleeping.
Okay. And when you see the child, are there different levels of severity of the syndrome?
So yeah, I mean, there's anywhere from they're just barely flat to, you know, we see pretty significant flattening. So everybody's different. You know, I was lucky neither one of my children developed a flat back of their head. So there are babies that don't develop a flat back of their head, and why some babies do and some babies don't, I don't have a good explanation for. But my kids were back to sleep kids, and
Yeah.
but luckily, I guess they moved their heads around enough in sleep that they didn't get a flat spot. So we definitely see different levels of molding. And again, sometimes it's one-sided, sometimes it's, you know, symmetric flat back of the head. I'm sorry, I forgot what the rest of the question was.
Well, just severity of it. So
Oh, yeah.
so there are different sort of different severities. I've seen infants with those helmets.
Mhm.
Is that a something that is being done for children with flat heads, or what are
So
the
yes and no. So it depends on the helmet and the case. So there are cases of abnormal skull fusions that after we do the surgery to release the fused skull, we put them in a helmet. So kind of like doing Invisalign for your teeth, we have to get those bones to move. And so we will put them in a helmet after those surgeries. But there's also plagiocephaly helmets, so molding helmets to help kind of reshape the skull as well. So if you're just seeing a child in the street, you don't know which case it is, frankly.
Right.
Helmets, again, after the Back to Sleep campaign, and everybody started seeing these flat heads, then the helmet therapies came about. It works. Like I said, plagiocephaly is not dangerous to the brain or to the child's development. It's cosmetic. So helmet therapy is an option. It is not a requirement. It works, but long-term studies. So if you look at children like 4 years out that had positional molding, comparing the patients that used helmets to patients that did not use helmets, there is no statistical difference between their reshaping. So most children will reshape their heads just with repositioning techniques. And you know, eventually kids stop laying on the back of their heads. They start flipping over in their sleep and they start sitting up, so they're not laying on the back of their head anymore. And so then the brain takes over and pushes the skull back out into a quote normal shape.
Okay.
So helmets work. They're not required. They're not a must have or a must do.
Okay. So you're saying that eventually it's self-correcting.
Yes, usually eventually self-correcting, maybe not 100%, but helmets don't correct 100% either.
Okay.
And so that's why I say when you compare those two groups, there's not really a difference in the complete outcomes. So some patients still have some flatness to their head. I tell families nobody's skull is perfect, and that's why we have hair.